This is a two-level thoracic oblique interbody fusion, what we call OTIF. This is at 8:53 we do the marking. The surgery starts by putting a Jamshidi in T11 here. So this is now 8:56. And then we put Jamshidi in, take bone marrow, and then take more bone marrow from the next level, and then we approach obliquely, very steep actually, through Cambin triangle, and while stimulating at 3 milliamp, go to 4 milliamp, and then we enter the disc base. Now, obviously, we have to put in for these levels, T9 to 11, abdominal electrode. Sometimes for higher level, we put intercostal electrode, and see how the configuration of the spine first changes unilaterally, but then once we do the discectomy, there's really not much of a disc there. And then when we put the cage in, look, it lifts it up and becomes straight again. So, and then in the same fashion, after we put Jamshidi in the T9, we approach the disc in the T9-10. In the same fashion, we do the discectomy. You see the osteophytes there. Quite significantly is that this is a very pathologic disc and causing significant axial pain and radiculopathy on the patient. So again, performing the discectomy, prepare the end plate, then pack it with the biologic, and then we put the cage in. So here, as you see, the cage is placed. Again, it lifts up the disc and open up the foramen. Then we finish the placement of the K-wires in all levels. And here, at this point, actually, after all the K-wires are placed, the AP machine goes up. The rest of the surgery is done on the lateral. And here is the so-called decorticated surface of the facet. All the screws are going in now, and then the rod get inserted and locked in place. This is the second rod going in, adjusted the curvature, and tops are removed after it's locked in. And here is the final picture. Post-operatively, we always get CT of the chest to rule out pneumothorax and hemothorax. And here you see there's no pneumothorax or hemothorax. Contrary to direct thoracic, where you have 15 to 20% risk of pneumothorax, here in all our 40 cases we have performed, there has been no pneumothorax. And here you see the postoperative CT. We always, for thoracic cases, get postoperative CT. T9 to 11 hardware are well positioned, and the disc base is quite significantly elevated. Here we go, and here are the T9 screws coming up about now. Spacer, T10, and T11 screws. And these are the pictures from during the surgery, with the incision being this small one. These three are for the screws. The cage placement is very oblique. In the OLIF, it would be all the way down here, and this is where the rod was passed, which we close with subcutaneous stitches and Thoracic. And practically, this is a surgery that took us 51 minutes. Blood loss was more than usual. It was 174, which is for this patient totally acceptable.